Hi, my name is Dr. Iraj Kasimi from Hillcrest Dental in Las Vegas, and today we're going to be discussing dental crowns. What are dental crowns? A crown is a restoration that goes on top of your teeth. It's basically like a helmet that'll cover up your teeth and make things strong and healthy for a very, very long time. What are some alternatives, or what are the alternatives to dental crowns? Sometimes you can get away with a filling, possibly. It just depends how large the defect is in the tooth. If there's a small cavity or a small defect, we can restore that tooth with a filling. But if it needs a crown, then there's really no other alternative other than a crown. Some people have tried inlays or onlays, which we do offer, but in many cases those end up failing due to not enough protection of a tooth. They can cause a crack or the onlay to fall out. So crowns are done conservatively. When they're done well, they last a very long time, and it's the best option in many situations. What type of crowns are there? You have zirconia, you got porcelain, which is like an Emax or lithium disilicate. You have metal crowns, gold crowns, porcelain that's fused to metal crowns. So there's a wide range of different materials that we have options to use. What are the advantages and disadvantages of each of these materials? They have different levels of aesthetics, and they have different levels of strength. Traditionally, for many, many years, we used a lot of the porcelain fused to metal crowns. The disadvantage with those is they're so thick, they're so hard, and they can have that dark line at the gum line. A lot of patients don't like them, so we tend to not use that material anymore. We love to use zirconia. It's a very biocompatible, very nice material that your gums like and grow into and help reduce bacterial and plaque retention and help reduce inflammation. So zirconia is very, very strong. It looks really, really nice. In some cases on front teeth, we will use porcelain, also pretty strong, and they look really, really nice. Gold is also great, but most patients don't want the metal color of gold and the cost associated with that anymore. Is it necessary to get a crown after a root canal? And if it's on a back tooth, yes, you definitely will need a crown. If it's on a front tooth, we sometimes can avoid a crown and do a filling because back teeth take a lot more pressure and force when you're biting, and not getting a crown has been proven to lead to failure of those teeth. Can we explain the dental crown procedure? Yes, we can explain it. So, of course, we start with some local anesthesia, making sure you're numb, very, very relaxed and comfortable. Then we go in and remove any, bad parts of your tooth, such as an old filling or cavities, get all that cleaned up. Then we restore the tooth with a buildup material to build it back up. And then we reshape and prepare the tooth for the crown. So we just need about 1.5 millimeters of space for the crown. Then we go ahead and put on your, take a digital scan or a digital impression, which are some digital photos of your tooth. And then you leave with your new temporary crown. Then we'll bring you back in and put the permanent crown in a few weeks after that. Does it hurt to have a dental crown done? The answer is it shouldn't. Absolutely not. I mean, if your dentist is doing really good local anesthesia, which we're very serious about, it should not feel any discomfort during the procedure itself. It's normal to have a little bit of sensitivity after, but that usually will go away. Are there any consequences for getting a dental crown? No, there are no negative consequences with it. There's always a possibility sometimes when you get work done on a tooth that the tooth may become sensitive later on and require a root canal, but that's a pretty low chance of that. Mainly what we're doing with crowns is preventing problems. So we're preventing that tooth from breaking in half, preventing that tooth from chipping, preventing you from having pain or getting cracks and other things covered up so they don't cause a bigger problem for you. Is it worth putting a child's tooth in crowns? If the cavity is large enough, there are stainless steel crowns and other temporary type of crowns that can be done for children's teeth. We don't usually do permanent restorations or crowns on children's teeth unless they have a very, very large cavity. So yes, we can do crowns on kids, permanent crowns, but we usually try to wait until they're adults. Do crowns look like normal teeth? Yes, they do. The restorations we use today are both very, very strong and also very, very aesthetic. So we can get a great result, use a very biocompatible material that's going to look nice and be very, very long-term for you, for sure. Can you get a cavity on a tooth with a crown on it? The answer is yes, but would be under the crown. The crown itself can't get a cavity, but if you don't brush your teeth or floss your teeth, you can develop a cavity under your crown on the root area or below the prep or the actual tooth is itself. How should I take care of my crown? It's very, very similar to taking care of any other tooth. We just want to make sure we're flossing and brushing, keeping things very, very clean and healthy. And we just want to avoid any excess pressure on teeth. So you want to avoid biting into things that are extremely hard, but you should be doing that with your real teeth anyways. If you have any other questions, please reach out to us. We'd be happy to meet with you in person to discuss more about dental crowns. You can reach out to us at 702-395-1088. You can call or text us, or you can schedule an appointment online at hcdentallv.com.